Okay, now on this, in this short video, I want to focus on how does CRMA, computerized radiographic mensuration analysis with spinal kinetics, help a doctor with pre-existing conditions? Well, first of all, you have to understand pre-existing conditions. And so let's start with just the neck, for example. The neck has one more joint than the whole lower extremity. Now, the lower extremity has 30 joints to it. If somebody damaged, let's say their ankle in college 7, 8, 10 times, and they had degenerative change in the bones of the ankle, and now they were in an injury in the crosswalk and a car hit them and damaged their right knee. Okay, in the right ankle they have degenerative change. Nobody would say, well, first of all, no one would say they have a lower extremity injury. They would actually start to identify where and what part was injured. They have a knee injury, they have an ankle injury, they have a toe injury. Okay, second, nobody would look, and if they took a full lower extremity x-ray, that no one would look at it and say, well, the knee problem is caused from the degenerative changes in the ankle. Yet that's what happens today in the spine world. The spine world is, oh my gosh, they have C5, C6 degenerative change, it's severe, this is what's causing all the problems, it's all due to a pre-existing condition. Well, that's because there's not a separation of the parts. That's because it'd be no different than if your son or daughter came home and they were in a soccer accident and they had to go to the emergency room and it took them 3 hours and they had a bad leg injury. And they came home and said, well, what's the deal? Hey, you have a lower extremity, your child has a lower extremity injury. The first question you're going to ask is, okay, what does that even mean? Like, is it the knee, is it the hip, is it the foot, is it the ankle? What does it actually mean? They don't do that with the neck, cervical spine or lumbar spine. They say, hey, you have a cervical injury. Well, that's no different than saying, hey, you got a lower extremity injury. You might as well just say you have a body injury. Okay, first of all, the cervical spine and the thoracic spine and the lumbar spine is built of parts. Individual separate parts acting as one whole unit to provide the function that the spine is supposed to do. So when you look and say, hey, I got degenerative change at C5 and C6, okay, if you have degenerative change at C5 and C6 and you're in an auto accident, that force is going to the healthy joints. It's going to dissipate at the stiffer joints, and it's going to the healthy joints. So you actually look at it and say, oh my gosh, look, the person has a surgical level of damage at C2, C3 based on our testing results, and there is no degenerative change there. There is no pre-existing condition to contend with there. Zero. So once you understand ligaments and ligament testing, and then you understand there's a difference between a dormant and an active pre-existing condition. A dormant pre-existing condition is something that's not been treated. It's not been actively treated prior to the accident. It's not under treatment. It's a dormant pre-existing condition. It weakens the spine, and it makes the spine more amenable or more probable of being damaged. So if you have an active pre-existing condition, then you have to look at the level. If I had an active ankle injury, okay, and I was under treatment, and basically I got a new knee injury in the crosswalks like I used before, or I have this ankle injury, right? I sprained my ankle 4 weeks ago. I'm in the physical therapist's office. I'm getting treatment for it. It happened in a basketball gym. I was playing basketball and I twisted my ankle, right? Now, 4 weeks later, crossing a crosswalk, I'm on my cell phone, I'm not really paying attention, neither is the guy in the car is using his cell phone, and guess what? He hits me. Can't stop fast enough, hits me in the right knee, damages my right knee. Okay, is anybody going to actually say, well, the problem is your ankle? Look, you were under active treatment for your ankle, and that's what's causing your knee injury. No, these injuries are separate. That's a separate injury. Now, the active ankle injury can reduce down the ability to rehab the knee. I'll go with that. But they're separate injuries. So doctors, what CRMA testing does and what Spinal Kinetics does is it's evolving the world of spinal care. Look, no professional, if you're a chiropractor right now, you've had no formalized training in school on spinal injuries. If you're a medical doctor, and I'm speaking to you right now, you've had no formalized training either. If you're an osteopath, you've had no formalized training. And if you're a doctor of PT, you've had no formalized training on the spinal injury itself. The spine is the #1 cause of chronic pain and disability. It's the first, fourth, and sixth leading cause of chronic pain and disability, and no one in the country's had any training on it in their professional, in their educational curriculum. Not one. So it's no wonder that there's a misunderstanding, and it's so hard, it's so easy to get confused in this market. At Spinal Kinetics, we're helping to simplify the understanding by providing FDA-cleared high medical services, unbiased, independent service that everyone can trust in the results, but in the process, we're also helping to solve. Our main goal is better diagnostics will result in better treatment innovations so that there's a serious reduction in chronic pain associated with these injuries. Our belief is in the future, patients will have these injuries and they will not suffer long-term as a result of them, even though they are permanent, that the treatment innovators will reduce that permanency. It will repair the tissue. It'll do whatever it takes to actually change that. But the first thing you have to understand is where and how bad it is, and that's what we do at Spinal Kinetics, and it can seriously help you with the idea or the barrier, or whatever you want to call it, of pre-existing conditions in the spinal injury space today.